Hi Jane, it's Lauren Hill, and I'm going to be talking about middle-aged children with disabilities. I chose this topic because I have worked with children with disabilities in the past, and I find it very interesting working with them, and I like knowing that I can help them. I would love to help educate parents who are facing the challenges of their children with disabilities. I feel that this topic is important because there is an overwhelming amount of children who do face the challenges of having a disability. I feel people should be more educated on seeing how many children and families are affected by it. The most common disability for middle-aged children is ADD, attention deficit disorder, or ADHD. Children with ADD or ADHD may suffer from everyday tasks, which include sitting still, paying attention, and certain academic skills. A child who has ADD or ADHD shows excessive inattention, impulsivity, and hyperactivity. ADHD or ADD usually occurs by the age of 7. These children struggle in school as they cannot sit still, and some of them may have difficulty getting along with other students. ADHD is more common in boys than in girls. The classroom environment can be a challenging place for the child with ADD or ADHD. The most frustrating part of it all is that most of the children who are suffering want to be able to learn and behave like their unaffected peers. But neurological defects keep kids with attention deficit disorder from learning in the traditional ways that usually happen in the classroom. If you are a parent who has a child who is suffering from ADD or ADHD, communicating with their teachers to see how your child learns best. With the support at home and teaching strategies in the classroom, there is no reason why kids with ADD or ADHD cannot succeed in school. The treatment to ADD or ADHD are stimulants such as Ritalin. The stimulant promotes the activity of dopamine in the brain. The stimulant increases the child's attention span and improving their academic performance. Many schools urge parents to medicate children with attention deficit disorder. Medication can help with some of the symptoms of ADD or ADHD, but it is not a cure and comes with side effects. As a parent, you should weigh the benefits and risks of medications for ADD or ADHD before using them to treat your child. Many intelligent children can also be diagnosed with learning disabilities. An example of a learning disability would be dyslexia. Children with dyslexia show many challenges and struggles, and some examples of the struggles that they face are difficulty in learning to read, letter and number reversals, and writing letters backwards also. Dyslexia can be related to brain injury, hereditary, or hormonal influences. Diagnosis of dyslexia involves reviewing the child's processing of information from seeing, hearing, and participating in activities. Treatment of dyslexia ideally involves planning between the parents and the teachers. A child is usually diagnosed with a learning disability when they perform below the level that others their age are performing. Children with dyslexia can be helped by giving them structured activities and one-on-one help to overcome the problems that they are facing. It is estimated that 1 in 6 Canadians do have dyslexia. Sensory and neurological problems contribute to dyslexic children. Dyslexic children may write letters upside down or reversed. Educating children who have disabilities may be challenging. Children who are given very structured exercises to help them improve with problems that they are facing will help them when it comes to school. People who would relate to this topic would be children and parents in which are affected by a disability. They would relate because these are some of the things that they are going to have to face and the things that they're going to have to go through with their child. What you should remember from this presentation is how to treat disabilities, Since the percentage is very high for having ADD, for example, you should be educated in case somebody you know is affected by it. You should know how to act appropriately and all the appropriate steps to take if your child does end up with dyslexia or ADD or ADHD or any disabilities.